Assalamualaikum and hi everyone. For today's lecture, I'm going to cover about anxiety. Let's say you have got a huge presentation in front of all your classmates. You are nervous, you have got quite a bit of stress leading up to the presentation. That stress is completely normal and really probably even useful in certain situations, since it can make you more alert and careful. And usually after the presentation is over, you feel the stress starting to fade away. But for a small percentage of the population, the stress doesn't go away. And maybe the stress isn't even brought on by a specific event, and it's always just sort of always there. Either way, at this point, it is considered to be anxiety, and that anxiety might even get worse over time and causes things like chest pains or nightmare. And sometimes the anxiety is so severe that it causes someone to be anxious about leaving the house or doing everyday things like going to school or work. And this anxiety might be a sign of generalized anxiety disorder, or sometimes shortened as GAD. Generalized anxiety disorder is characterized by excessive, persistent, and unreasonable anxiety about everyday things like money matters, family, works, and relationships. And even sometimes the thought of getting through the day would cause anxiety. So if the anxiety is persistent, it means that it doesn't seem to go away regardless of what you do. Excessive means that is usually more than someone else might feel, and by unreasonable it means that they probably shouldn't have a reason to feel anxious about in the very first place. So people who have generalized anxiety disorder might even understand that their anxieties are excessive and unreasonable, but they feel it's out of their control and they don't know quite how to stop it. The prevalence of anxiety disorders across the world varies from 2.5 to 7% depending on the country globally. An estimated 284 million people experienced anxiety disorder in 2019, making it the most prevalent mental health or neurodevelopmental disorder. And I can only imagine how much the number would have grown currently with the pandemic going on. People with severe generalized anxiety disorder or GAD might be completely debilitated and have trouble with the simplest daily activities, or they might only be mildly affected and be able to function socially and hold down a job. Sometimes the feeling might worsen or improve over time. In addition to having feeling of worries and also anxiety, other symptoms include edginess and also restlessness, difficulty concentrating or feeling like the mind just go blank, and also irritability. The psychological symptoms of anxiety can also lead to physical manifestations such as tremblings of the hand, heart palpitations, dizziness, shortness of breath, chills or heat sensations, or also nausea. And sometimes also lead to digestive problems from eating more or eating less. They might also have muscle ache and soreness from carrying tension in their muscle. And finally, difficulty sleeping is a really common symptom that can have a serious impact on physical well-being, and since the body is not resting properly, and this can lead to issues of chronic fatigue. So this is some of the physical manifestation of symptoms. Although the decision that someone's worry is excessive and unreasonable has a subjective quality, diagnosing generalized anxiety disorder is aided by the Diagnostic and Statistical Manual of Mental Disorder or DSM-5. And this manual gives a list of criteria to meet in order to be diagnosed with generalized anxiety disorder. First, the excessive worry and anxiety has to have been present for more days than not over the course of 6 months. In other words, a person should have the symptoms of excess or unreasonable worry on 90 or more days out of 180 days. Generally, people cannot quantify or track their feelings in that way. So again, this is meant to offer a general guideline. Secondly, the person finds it hard to control the anxiety, meaning that they have a hard time calming themselves or self-soothing to help themselves regain control over their feelings. Third, an adult must have 3 or more of the symptoms listed previously. And in children, though they typically define as school age, which is between 6 to 18 years, only one symptom is needed for the diagnosis of generalized anxiety disorder. Another criteria is that the anxiety causes impairment in important daily activities like school or work. For example, they might miss deadlines or find it difficult to even go to work because of their symptoms. And fifth, the symptoms are not attributable to the physiological effects of a drug or a medication or due to medical conditions such as hyperthyroidism, which creates an excess of thyroid hormone, which can sometimes can cause the symptoms of anxiety and worry. And finally, the anxiety is not better explained by another mental disorder like social phobia or panic disorder. So this is some of the criteria in terms of diagnosing generalized anxiety disorder. Just like other mental disorders, it is unclear exactly why some individuals develop generalized anxiety disorder. But it is thought to be a combination of both genetic as well as environmental triggers, as it seems to run in families. Basically, there is an imbalance or abnormal functioning of neurotransmitters such as norepinephrine, serotonin, dopamine, and also gamma-aminobutyric acid or GABA. And consequently, this resulted in the amygdala maladaptively activating fear responses. There would be an activation of the hypothalamus between the adrenal cortex axis as well as the activation of autonomic nervous system and adrenal medulla. And consequently, this would lead to the psychological as well as physical manifestations of anxiety that was discussed earlier. Studies show that there is a link between anxiety disorders and specific areas of the brain, and that an imbalance in certain neurotransmitters in the brain that regulate anxiety, especially serotonin and GABA, which may contribute to the symptoms of this disease. The amygdala that is responsible for triggering the anxiety attack, and the brain circuits in the amygdala are thought to comprise inhibitory networks of gamma-aminobutyric acid or GABAergic interneurons. And this neurotransmitter does play a key role in the modulation of anxiety responses both in the normal and pathological states. So GABA is such as inhibitory neurotransmitter, and it also plays a role in stopping anxiety signals from being sent from amygdala to frontal cortex. GABAergic neurotransmission in the amygdala is therefore a promising candidate for modulation of anxiety-related responses. In addition to GABA, serotonin plays an important role as well. Serotonin plays a vital role in the development and the persistence of anxiety disorders. Serotonergic neurons are involved in the alteration of appetite, energy, sleep, mood, and also cognitive function in anxiety. Its role in anxiety is supported by its modulating effect on the locus coeruleus and it is projection to the amygdala. So the neurons located in the dorsal and median rough nuclei of the brainstem are the primary source of serotonin production in the brain. Excessive levels of serotonin in the hypothalamus, basal ganglia and also limbic system may be related to symptoms of anxiety, and some studies have demonstrated that there is an increased anxiety behaviors in knockout mice spread without 5-HT1A receptors in the cerebral cortex and also limbic system, suggesting a key role specifically for 5-HT1A receptor in this respect. So 5-HT1A receptors can be found in the brain as presynaptic autoreceptors on serotonergic cell bodies in the rough nuclei, and upon stimulation, these receptors inhibit firing of 5-HT neurons. Treating generalized anxiety disorder, like many other mental disorders, may involve psychotherapy, self-help, and medication, or a combination of all three. If psychotherapy, cognitive behavior therapy, has been effective, since it would teach the patient to think and behave in different ways and react to situations differently. Medications such as benzodiazepines or SSRI or selective serotonin reuptake inhibitors might be prescribed to control anxiety. And as you know, benzodiazepine is a group of drugs that have a relaxing and calming effect, whereas selective serotonin reuptake inhibitors would regulate serotonin levels in the brain and help elevate mood.